Assalamualaikum warahmatullahi wabarakatuh. Today we will explain about process. We are from group 5. Its member is, the first is AMITRA, the next AULLYA AFRIZAL, and the last one is NATALINUS IMMANUEL MALAU. For the first, I will explain about what is a process essentially. As you open your bedroom door, there is a series of movements ranging from your holding the handle door, pulling it down, and then pushing the door open. Those three consecutive actions make up a simple process. As children grow up, there is a series of change happening in space and time. All the happenings constitute a complicated and long process. On process, the series of learning activities dealing with the first is transcriptions and pronunciations, and the next is identifications of terminologies, and the next is differentiations, and the next writing, and the last one is answering, all of which are geared to function and ability, action in sequence, cause and effect, and methods. The first of process is functional ability. The first is function of the brain. The brain functions by complex neuronal of nerve cells circuits. Communications between neurons is both electrical and chemical and always travels from the dendrites of a neuron through its homa and out in its axons to the dendrites of another neuron. Dendrites of one neuron receive signal from the axons of other neurons through chemicals known as neurotransmitters. Neurotransmitters can be excitatory, that is, they excite an electrochemical response in the dendrites receptor, or inhibitory. They block the response of the dendrites receptors. The next is below are the keys to the function of the brains. The first, they communicate both electrically and chemically. Second is they receive signal through chemical known as neurotransmitters. The next, they set off change in the dendrites. Next, it integrates informations. The next, it is like a small bubble. The next is they release neuron transmitter. Next, there are two kinds of neuron transmitters. The last one is they block responses of the dendrites receptors. Next, simplifying sentence. The first, neurons functions to communicate both electrically and chemically. Neurons functions to transmit information from dendrites of a neurons. And dendrites of one neuron function to receive signal from the axon of other neurons. The next, neuron transmitters functions to set off electrical change in the dendrites. Next, neuron transmitters functions to carry signal electromagnetically to the soma. The soma functions to integrate informations. Next is the soma functions to transmit information electromagnetically down the axons to in its tip. The next, physical functions to release neuron transmitters. Physical functions to carry signal across the gap between two neurons. The last, neurons functions to communicate with thousands of other neurons. The next function is the action of bile. Bile is a digestive food produced by the liver and stored in the gallbladder. It plays a crucial role in the digestion and absorption of fat in the small intestine. The next slide will be explained by Noel. For Noel, time is yours.
The next is the action of bile. Bile is a digestive fluid produced by the liver and stored in the gallbladder. It plays a crucial role in the digestion and absorption of fats in the small intestine. The action of bile can be summarized as 1. Emulsification of fats. Bile contains bile salts, which are amphithetic molecules that have both hydrophobic and hydrophilic properties. These bile salts break down large fat globules into smaller droplets in a process called emulsification. This increases the surface area of the fat, making it easier for the digestive enzymes to act on it. The second is the neutralization of stomach acid. Bile is alkaline in nature and helps to neutralize the acidic kind, partially digested food, coming from the stomach. This creates a more favorable pH environment for the action of pancreatic enzymes, which are involved in the digestion of carbohydrates, proteins, and fat. The third is activation of pancreatic lipase. Bile also plays a role in the activation of pancreatic lipase, an enzyme produced by the pancreas that is essential for the digestion and breakdown of dietary fat. Bile salts form micelles that provide a platform for lipase to interact with fat, further aiding in their digestion. The fourth is facilitation of fat absorption. The emulsified fat droplets, along with the products of fat digestion, are absorbed in the small intestines. Bile salts are necessary for the absorption of fat-soluble vitamin A, D, E, and K, and fatty acids. They help transport these nutrients across the intestinal wall. The fifth is recycling of bile salts. After aiding in the digestion and absorption of fats, some of the bile salts are reabsorbed in the ileum, the last part of the small intestine, and transported back to the liver via enterohepatic circulation. This recycling process helps conserve bile salts, reducing the need for constant synthesis. The primary action of bile including emulsifying fats, neutralizing stomach acid, activating pancreatic lipase, facilitating fat absorption, and recycling bile salts to optimize the digestion and absorption of dietary fats and fat-soluble nutrients. The function of the liver. As mentioned before, it is included in the 5 points that I have mentioned before. The liver consists of 7 main parts: the bile ducts, the hepatic vein, the right lobe, the left lobe, the falciform ligament, the hepatic duct, and the gallbladder. These are the scheme of the liver in making the enzymes. Next part will be explained by my friend.
Okay. Assalamualaikum warahmatullahi wabarakatuh. My name is AULLYA AFRIZAL. I would like to represent about our materials. So here's about action in sequence. In the context of English for science, action is sequence typically refers to describing or explaining a series of steps or procedures in a logical order. This is commonly used when writing laboratory reports, research papers, or scientific documentation to ensure clarity and reproducibility of experiments or process. Each step should be presented in a sequential and coherent manner. So this is a timeline, table of timeline. So in here, as you can see, like 6 years after date, 3 years after date, and 3 years after date. Like this studying at elementary school, and then studying at the junior high school, and studying at the senior high school. Now, uh, please pay attention in the timeline above. So before B occurs, A occurs is before and prior to the occurrence of B, I occurs. After has occurred, B occurs is after or following the occurrence of A, B occurs. We'll make this a simple explanation so you can get it. I will give a example like so. The example is a nurse give an injection. She washes her hands. So we use before. So before a nurse gives an injection, she washes her hand. You got it? Okay, I will give one example again. Like the nurse applies soap to her hands. She washes them. So we use after. So after the nurse has applied soap to her hands, she washes them. Okay, you got it? Okay, the next is procedures. Surgical procedures are classified as option, required, elective, urgent, and emergent based on the patient's medical condition. First is optional. Surgery consists of operations that are not required but which the patient chooses to undergo, as with some types of cosmetic surgery. Required and then is required surgery is performed when the only surgery will correct a problem such as cataract, but surgery can be delayed for a period of weeks or months. And then is elective surgical procedures usually involve conditions that may not require surgery, but in which surgery will have a favorable effect, such as the removal of a small cyst. And that is urgent surgical procedures are performed when a patient condition is not immediately life-threatening, but failure to treat it may result in the death. Patients with some form of the cancer are often considered urgent surgical cases. And the last is emergency procedures must be performed within a few hours of a patient arrival as at a hospital to prevent death. These surgeries correct serious life-threatening conditions such as major wounds, blockage of the intestines, or appendicitis, inflammation of the appendix. For any surgical procedure, medical care is provided before preoperative, during intraoperative, and after or postoperative the operations. Preoperative care includes routine checks of vital signs including temperature, pulse, and the blood pressure, analysis of blood, urine, and physical examination to evaluate organ function. An anesthesiologist of second trained to provide anesthetic. Anesthetics looks for signs that might make the administration of anesthetics dangerous, such as chest infection or low blood pressure. A history of the patient use of medication is acquired to prevent possible adverse interaction with anesthetic. A surgeon will generally counsel the patient and his or her family about the surgery and what to expect after the operation is performed. Preoperative care reduces the risk of complication during and after surgery. And intraoperative care involves several members of the surgical team. The surgeon determines the timing of the operation, the techniques, and the instrument and supplies to be used. The anesthesiologist controls the patient pain and, if necessary, the level of unconsciousness to make surgery more tolerable and ensure that the patient regains consequences safely and quickly following the operation. The screw nurse reads all the instruments, ensures the sterility of the surgical field, and anticipates when instruments will be needed by the surgeon. The circulating nurse makes sure the operating room is adequately supplied and provides any additional supplies to the scrub nurse during the operation. Depending upon the hospital, surgeon assistants, second assistant, surgeon's resident, medical student, and nursing student may also attend an operation. Okay, this is the last. Post-operative care begins in a recovery room or intensive care unit or ICU. Both areas are equipped to monitor blood pressure and heart rate and provide supplemental oxygen, mechanical ventilation for the lungs, and physical support under critical circumstances. Drugs are often prescribed to control postoperative pain. Okay, pardon me. Okay, that's all for us. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.